Vitamin B3 is known for increased alertness, clarity, focus, memory, enhanced mood and energy. It's a potent antioxidant and a free radical scavenger. It lowers LDL cholesterol, it increases HDL cholesterol, and it lowers triglycerides. Vitamin B3 is one of 8 B vitamins. Niacin is a precursor to the coenzymes nicotinamide adenine dinucleotide and nicotinamide adenine dinucleotide phosphate. NAD is needed to catabolize fats, carbohydrates, protein, and alcohol, and NAD is involved in cell signaling and DNA repair. NAD also converts to NADH, which is the primary carrier of electrons in the transfer of food from your diet into energy. This energy is stored as adenosine triphosphate, or ATP. The ATP provides the fuel for the mitochondria in each of your cells. Not enough NADH leads to ATP depletion, which can eventually lead to cell death. The Russian-designed nootropic Picamillan is a combination of niacin and GABA, and it's used to improve memory, concentration, focus, relieve anxiety, and lower blood pressure. Studies have shown that supplementing with niacin improves cognitive function, enhances cellular energy, boosts cerebral circulation, increases endurance, switches off aging genes, and it extends lifespan. Niacin is a precursor to NAD and NADH, and this repairs cells and DNA damage, and it stimulates your immune system. Niacin boosts the production of nitric oxide, which relaxes blood vessels in your brain, increasing cerebral blood flow, and niacin acts as an antioxidant, helping to eliminate free radicals that can damage brain cells. As a precursor to NADH, niacin provides electrons for ATP synthesis within our mitochondria for cellular energy. Low levels of niacin result in brain fog, slow mental processing, and cognitive decline. Niacin affects cognitive function by stimulating the production of dopamine, norepinephrine, and serotonin. These neurotransmitters are involved in memory, learning, cognition, recall, and mood. Vitamin B3 is the precursor to the coenzymes nicotinamide adenine dinucleotide and nicotinamide adenine dinucleotide phosphate, NAD and NADP. Niacin is found in and critical for the health of every cell in your body. NADH is the reduced form of the NAD, making it the active form, which can then donate electrons. NADH is the primary carrier of electrons from glucose and lactate for ATP synthesis. ATP is the fuel source that's produced within the mitochondria, the power supply in each of your brain cells, so you need niacin to produce the NADH to transfer the energy from the food that you eat into a type of energy that your body can use. Niacin naturally occurs in foods like eggs, fish, meat, milk, peanuts, mushrooms, green vegetables, and yeast. Your body also naturally synthesizes niacin from the amino acid tryptophan that you get from food. This synthesis requires vitamin B6, riboflavin, and an enzyme containing iron. But only about 2% of dietary tryptophan gets converted into niacin, not nearly enough that your body requires, which is why supplementation is needed. Niacin supplementation has been used to treat addiction, ADHD, arthritis, Alzheimer's disease, depression, memory loss, and schizophrenia, and for detoxifying nearly every foreign substance that can find its way into your fat cells. As a nootropic, niacin can help to boost cognition, memory, and neuroplasticity. Niacin is the precursor to NAD. NAD acts as an electron carrier, meaning it can accept and donate electrons to various enzymes involved in energy metabolism. NAD is transformed into NADH. NADH then donates its electrons to the electron transport chain, where a number of ATP molecules are then formed. Using niacin as a supplement increases the available NAD molecules that can take part in energy metabolism, and it can increase the amount of energy in each cell. By providing the means for ATP synthesis, niacin is involved in cognition, focus, concentration, memory, and processing speed, and niacin plays an important role in mediating brain aging and tissue damage, even decreasing the damage done by strokes. Researchers at Massachusetts General Hospital in Boston studied the neuroprotective effects of CoQ10 and niacin in mouse models of Parkinson's disease. Impaired energy metabolism has been associated with some of the symptoms of Parkinson's disease. Researchers administered MPTP, which is a poison to neurons. It disrupts the energy metabolism of the neurons that release dopamine. The affected dopamine cells are also unable to release as much glutamate, which results in decreased dopamine in people with Parkinson's disease. The combination of CoQ10 and niacin protected against both mild and moderate dopamine depletion. The researchers concluded that CoQ10 and niacin improve mitochondrial energy production. Brain-derived nootropic factor has been termed miracle grow for the brain. Higher levels of brain-derived nootropic factor has been associated with increased intelligence, mood, productivity, and memory. Researchers at Henry Ford Hospital in Detroit tested the hypothesis that niacin could increase synaptic plasticity and axon growth in stroke patients. Male Worcester rats were purposely given a stroke and then treated with extended-release niacin for 14 days. Niacin increased synaptic plasticity and axon growth as a result of restored brain-derived nootropic factor. Another study published in the Journal of Clinical Endocrinology and Metabolism showed that niacin stimulated growth hormone. Niacin deficiency is considered rare by government health agencies, particularly in the West, but even mild niacin deficiency can have a negative impact on your health and your cognition. A mild niacin deficiency can be caused by digestive problems that decrease the amount of vitamin B3 or tryptophan that your body can absorb. If you're gluten intolerant, you're at a higher risk of being niacin deficient. If you've got irritable bowel syndrome or Crohn's disease, you've got an increased chance of a niacin deficiency. Excessive alcohol consumption, birth control pills, anorexia, and those on a vegan diet can also be deficient in niacin. Energy levels can decline, fatigue can increase, anxiety, hyperactivity, depression, headaches, and even hallucinations can occur. Metabolism declines, insomnia increases, irritability increases. Some experts believe that a lack of niacin and other B vitamins is at least partially responsible for the large increase in mental health disorders and violent crimes in recent years. All of these niacin deficiency related changes are contributing factors to neurodegenerative disease of aging, age-related cognitive decline, including Alzheimer's and schizophrenia. But even if things haven't degenerated to such a debilitating level, niacin can help. Research has shown that people with low levels of niacin are far more vulnerable to addiction, depression, heart disease, schizophrenia, and other chronic conditions. Low niacin levels can happen at any age, even at birth. Supplementing with niacin has been shown to help those who are at an increased risk of heart attacks and strokes and other forms of heart disease. It can help to reduce hardening of the arteries, known as atherosclerosis, and it can assist in avoiding heart disease. It also helps to reduce inflammation. Niacin plays a role in diabetes treatment because it helps to balance blood sugar levels. It also helps to reduce skin inflammation, flare-ups, irritation, redness, and helps for treating severe cases of acne. Niacin supplementation is associated with a decreased risk of age-related cognitive decline, memory loss, migraines, depression, motion sickness, insomnia, and even alcohol dependence. Niacin is also used for treating and to help schizophrenia. Studies show that niacin supplementation lowers the risk or the severity of ADHD. Niacin is an effective treatment for erectile dysfunction because it acts as a vasodilator that helps to improve blood flow to the penis. Niacin supplementation can help to relieve depression and anxiety. Circulation should improve and you'll feel like you've got more energy. People taking statins to control cholesterol report severe side effects, but when adding niacin to their supplement stack, most experience a reduction in blood pressure, and some have stopped taking the statins as a result. Those dealing with obsessive-compulsive disorder report that combining niacin with St. John's wort reduced the obsessive-compulsive disorder symptoms, and it was better than using an SSRI like Prozac or a benzodiazepine like Ativan. Taken before bedtime, some users report a reduction in insomnia. Lower back pain and hip pain may be reduced with niacin supplementation, and niacin can help to reduce severe acne and other skin inflammatory problems. Therapeutic doses of niacin have been shown to reduce serum cholesterol. Niacin significantly increases HDL cholesterol, or good cholesterol, and it decreases LDL, or bad cholesterol, and triglycerides. Changes in blood lipid profile are considered to be protective of your heart. Low levels of HDL cholesterol are one major risk factor for coronary heart disease, and an increase in HDL levels is associated with a reduction of that risk. The Coronary Drug Project was conducted between 1966 and 1975 to assess the long-term efficacy and safety of niacin in 8,241 men aged 30 to 64 years. All men had experienced some type of heart problem. Compared to placebo, patients who took 3 grams of niacin daily experienced an average 10% reduction in total blood cholesterol, a 26% decrease in triglycerides, and a 27% decrease in recurrent heart attacks, and a 26% decrease in stroke. If you're dealing with chronic health issues, chances are good that you could benefit from a detox program. Even if you're feeling perfectly healthy, you'd likely use a good detox. Simply living in our modern society exposes us to thousands of chemicals that have the potential to get into our body from the food we eat, the air we breathe, the water we drink, and the things that we touch. One study done in Portland, Oregon, investigated the effects of a 7-day detox program on well-being in 25 disease-free, healthy participants. The 7-day detox produced a statistically significant 47% reduction in the metabolic screening questionnaire scores and a 23% increase in liver detox capacity. Even healthy people feel better after the detox. A niacin detox program has been used to treat Gulf War syndrome, the firefighters and the first responders to the 9/11 attacks in New York, and it's also used by hundreds of naturopaths. Niacin affects adipocytes, which cause an increase in free fatty acid release from adipose tissue or body fat. The release of free fatty acids releases the fat-stored toxins for excretion from the body. Niacin also causes prostaglandin D2 releases, and this dilates small blood vessels in the skin, the same reaction responsible for the niacin flush. This dilation increases the movement of xenobiotics, or foreign chemicals, for excretion through sweating, which is where the sauna comes into the detox program. Niacin is also a precursor to NADH, which regenerates the master antioxidant glutathione. Niacin reduces inflammation by decreasing reactive oxygen species and inflammatory cytokines. Niacin is especially helpful if you're taking antidepressants. Drugs to treat depression have an anti-inflammatory effect, including inhibition of the rate-limiting enzyme of the kynurenine pathway. This metabolic pathway is involved in the production of NAD and NADH. The inhibition of this pathway increases serotonin, as more tryptophan becomes available for serotonin synthesis. More serotonin helps to decrease depression. This also leaves less tryptophan available for niacin synthesis, which causes depression and basically cancels out the other benefits of using the antidepressants. So if you're on SSRIs, you might want to add niacin to your diet. Dyslipidemia is the name of the condition involving high LDL bad cholesterol, high triglycerides, and low HDL cholesterol. Dyslipidemia is closely related to erectile dysfunction. Researchers in Hong Kong ran a placebo-controlled trial with 160 male patients with erectile dysfunction and dyslipidemia. Half of the men with erectile dysfunction received 1,000 500 milligrams of niacin, and the other half received a placebo every day for 12 weeks. The main outcome of the study was a significant improvement in erectile function, and the researchers concluded that the niacin alone can improve erectile function in men suffering from moderate to severe erectile dysfunction. Niacin is naturally produced in your body from tryptophan, and you get niacin from eating certain foods like beef, chicken, tuna, and sunflower seeds. Higher doses of niacin are usually divided into evenly split doses 2 to 4 times per day. So 2 grams of niacin would be 500 milligrams 4 times per day. For prevention of heart disease, 4 grams of niacin was used. Lowering bad cholesterol and boosting good cholesterol, 4 grams of niacin. To slow the progression of newly diagnosed type 1 diabetes, 25 milligrams per kg of body weight of niacinamide was used per day. For preventing or treating vitamin B3 deficiency, 50 to 100 milligrams per day. To treat pellagra, which is a severe niacin deficiency, 300 to 500 milligrams per day. For treating osteoarthritis, 3 grams per day. For reducing the risk of cataracts, 44 milligrams per day. Preventing Alzheimer's disease, 100 milligrams per day. Treating erectile dysfunction, 500 milligrams 3 times per day. And treating schizophrenia, 3 grams of niacin with 3 grams of ascorbic acid vitamin C per day. Standard niacin as nicotinic acid is naturally produced in your body and is considered non-toxic. Niacin can lower blood pressure, so if you're on blood pressure lowering medication, be cautious about supplementing with niacin. Niacin may decrease the effectiveness of diabetes medication because long-term use of niacin can increase blood sugar. You may need to increase your diabetes medicine accordingly. Statins are notorious for causing muscle wasting, and when combined with niacin, it may increase this muscle wasting problem. You may want to cut back on your statins as you increase your niacin dose. Many stop taking statins altogether when using niacin. Niacin as nicotinic acid and sustained release niacin causes flushing in many people. Regular immediate release nicotinic acid niacin causes flushing, and many people avoid supplementing with niacin as a result. Standard niacin flushing results from the activation of the niacin receptor G protein coupled receptor in the skin's Langerhans cells. This leads to the production of prostaglandins, including prostaglandin D2 and prostaglandin E2, and these act on the receptors in the capillaries, the small blood vessels in your skin. This flushing sensation comes from blood vessel dilation, and it manifests itself as a redness, a warmth of the skin, a tingling, and an itching. It happens rapidly and it lasts for about 1 hour. This flushing sensation is not an allergic reaction, and it only feels uncomfortable. There's some strategies to avoid a niacin flush. Like slow-release niacin can prevent the flushing, but it's not the answer because it will not provide the LDL, bad cholesterol lowering benefits, and it can be toxic to your liver when used long-term. Inositol hexanonicotinate is commonly referred to as a no-flush niacin, or a flush-free niacin, and is preferred by many users. Even though a couple of clinical studies claim that this version of niacin has no effect on lipid profiles, when it comes to cholesterol, some users consistently report the opposite. They do not experience flushing with the inositol hexanonicotinate, even at the high doses, and their cholesterol and triglyceride levels come within a healthy range. A newer version of extended-release niacin, called Niaspan, does not produce the flushing effect, and it's been shown to have the same effect on good cholesterol and triglycerides as instant-release niacin. Niaspan is prescription only, and is now available as a prescription generic at lower cost. One effective way to reduce flushing with an instant-release niacin and extended-release niacin is to take 325 milligrams of aspirin 30 minutes before taking the niacin. You could also try splitting your dose of niacin into smaller doses and taking that throughout the day. Flushing will be reduced if not completely eliminated, and long-term niacin users note that flushing goes away after about a week of long-term niacin use. Niacin is particularly helpful for vegetarians because very little niacin is available from vegetables. Niacin is especially helpful for those suffering from chronic fatigue syndrome and ADHD. It is suggested to start with a dose of 500 milligrams per day, and niacin is a great complement to any stack, including any nootropic. Do your best to use either free-form niacin if you can tolerate the flush, or even better, use an extended release version of niacin that has no flush and no associated toxicity. You need to provide your brain with the nutrients, including niacin, needed to create the ATP within the brain cells' mitochondria, or neurons start to break down from the inside. Signs that you're lacking adequate niacin are brain fog, slow thinking, fatigue, and low endurance. Some clinics in the US and other countries are using niacin therapy as a treatment for addiction, anxiety, depression, chronic stress, and even schizophrenia. It's recommended starting with a low dose of niacin until you build up a tolerance to avoid the niacin flush. Increase your dose every few days until you get to the dose that gives you the most cognitive benefit. At the very minimum, every user should be using a multivitamin every day that includes vitamin B3 niacin.